Omicron is generally less severe than previous variants. Does it still make sense to vaccinate children? As with any other vaccine or medical product, the decision of whether or not to vaccinate rests on whether the benefits outweigh the potential risks for the individual and at population level. In general, children are at low risk of severe COVID-19 disease, although serious conditions such as the multiple inflammatory syndrome in children, also called MIS-C, as well as post-COVID condition and myocarditis do occasionally occur. Recent surveillance data from the US has reported 91% effectiveness of the Pfizer-BioNTech COVID-19 vaccine in a 2-dose series in reduction of MIS-C in adolescents 12 to 18 years of age. Moreover, vaccinating children has additional benefits of minimizing disruption to their education, therefore improving their overall well-being. The potential risk of COVID-19 vaccination in children are also very low. The benefits of vaccination outweighs the very rare risk of pericarditis or myocarditis following mRNA vaccination, especially after the second dose in males 12 to 19 years of age. The probability of such events remains very low, less than 1 per 10,000 administered doses, and the vast majority of cases have evolved favorably in a few days and with hardly any treatment. Furthermore, it is important to remember that risk of developing myocarditis is much higher following COVID-19 disease. WHO recommends that children aged from 5 years to 17 years with comorbidities that put them at a higher risk of serious COVID-19 disease should be offered vaccination. A pediatric formulation of the Pfizer-BioNTech community vaccine is available for children aged 5 to 11 years of age and has been approved by the United States Federal Drug Administration, the European Medicines Agency, and other regulatory authorities. WHO further recommends that vaccination of healthy children should only be considered when high vaccination coverage of higher priority groups, including the administration of boosters, has been achieved.